Hi, I am Dr. Caitlin Keller, and I am the owner and lead physical therapist with Unconstipated Kids.
And my name is Erica Higginbotham, and I'm the lead occupational therapist on the Unconstipated Kids team.
And we want to talk a little bit about the differences between occupational therapy services, or OT, and physical therapy services, or PT, and how it relates to pediatric pelvic health services. Hi, my name is Dr. Caitlin Keller, and I am the owner and lead physical therapist at Unconstipated Kids. And here at Unconstipated Kids, our mission is to help kids move through and graduate from the challenges related to toileting struggles. So things like constipation, nighttime bedwetting, belly pain, reflux for infants, any kind of challenges related to the gut and toileting, keeping their underwear clean and dry. I hope that today's video pushes you into the right direction to get a great jump start and to move towards full resolution for your child from the challenges they're experiencing. A lot of families get referred to our clinic for maybe pelvic health PT or maybe specifically for OT, and then they start chatting with us and realize, wait, there's OT and PT. What's right for my child? How do I make this decision? The doctor referred me for this, doesn't matter. And so we are going to offer you some clarity today with answering those questions, and then maybe give you some screening tools to work through to help guide you in making that decision. If you feel like you're ready to jump in and you're not sure where to start, we want to give you a jumping place with this video and some guidance.
Sounds great.
So let's talk specifically about Unconstipated Kids. If your child was referred for pelvic health services, or you are just self-referring yourself for pelvic health services for your child, how do you know where to start? Like, do you start with OT? Do you start with PT? And what I want to start off by saying is that our evaluations at Unconstipated Kids look almost identical. Yes, we're going to have different lenses and how we tend to approach things on a baseline level. However, what we're looking for, it's the evaluation, the initial 2 hours almost looks identical. So a physical therapist is still going to go through the retained primitive reflexes and the sensory regulation and the emotional regulation. And the occupational therapist is still going to go through posture and lower extremity alignment and strength and that kind of thing. So our evaluations look very similar. So all to say, if you start in a place and maybe it's not the quote unquote correct choice, that's okay. You're still going to get a great initial evaluation, good information. And then we as the providers can say, yes, we did our initial evaluation. I think come back and see me in a couple months, but maybe go see Erica for some OT first, start with her, and then come back to me. So we might make suggestions like that, and that's okay. But just getting in, get started, that's the best thing that you can do, is start seeing somebody. So let's talk about how to give you some questions to maybe pose to yourself in relationship to your child. Ask yourself these questions and kind of discern, okay, maybe my child looks like they might be more in the occupational therapy camp, and maybe we start there, or vice versa with PT. So what are those questions that a family member could ask themselves to see?
Yes, I'd love to give you some questions, and we will also have all of this written out for you too if you are a visual person, so we'll have that for you to look at as well. But just to kind of give you a taste of what that looks like, if we are in the more of like OT camp, we'll be thinking about questions like, does your child really struggle with transitions or changes in routines, or maybe have really big emotional regulation challenges, or if you know they have primitive reflexes, if you've gotten tested somewhere else and you know that they have that in their history already. Also, a sensory processing piece too. So if they are really underreactive or overreactive to sensory stimuli, very sensitive or seeking out a lot, that might be a more OT realm to start with, because a lot of that can impact toileting too. And then on the PT side, if you know going in that your child definitely struggles with coordination, with strength, with balance, stability, any musculoskeletal or W sitting, back pain, knee pain, hypermobility, all of the big muscle body groups, things like that, that might be more in the PT camp of things.
Yeah, I think one way I like to pose it to families when I'm helping a family through a screen is, is your child keeping up with skills that their peers are easily doing, and maybe your child is struggling? Maybe that's a sign of coordination and something more related to PT. Not that we like comparing children, but sometimes how your child performs compared to their peers gives us some information. And then other times, other families will say, like, my child doesn't tolerate jeans. My child does not tolerate loud noises, maybe food textures, things like that. And so even just an initial conversation talking about those things can give us a clue as to where a child might need to start for services. So, whenever you're seeking out some kind of service for your child, your family, anybody in general, you have the opportunity to figure out if a provider, whoever that is, and whatever specialty that is, if that provider is right for you. And there can be a lot of hurdles to overcome if they are not right for you and they don't jive with you. Because if your trajectory or like your methodology of life, how you approach treatment or resolution or healing is different than your providers, then you might come to a head and not really get where you want to ultimately be with full resolution. So, before you start working with any provider, in general, let's talk about what that looks like. How do you figure out if somebody is right for you and your family and to work with them?
Yeah. You are allowed to ask questions, and I would encourage you to ask questions to get more information. What questions might you ask? You might ask, what does their continuing education look like? What do they value in terms of their treatment approach? What types of activities will you be doing? And sometimes that can be a little bit of an indicator of what their approach looks like and what you'll be expected to do in the office. Does the provider value education? So, they're with your child for 30 minutes, 45 minutes, but when you go home, you're the one that's there all the time. So, do you, as the parent, know the purpose of the activities, what you're looking for, why you're doing what you're doing? And if you just go to an appointment and they just say, okay, we're done, and you don't know what you're doing when you go home, then is that what you want out of your treatment? That's up to you to decide.
For us at Unconstipated Kids, the norm is that the family is in the treatment space with us 100% of the time, with a few exceptions. Whereas other locations, that might not be the norm. The norm might be that the family waits out in the waiting room while the child is back in the treatment space. And that could be your preference, but that's just something to think about ahead of time. Where you are going to be during the treatment is a really big piece, because you are going to get that education to help carry through at home.
Some other questions to maybe not ask, but just consider on a zoomed out level is, does their approach resonate with you? Do they care about your goals? Are your goals aligned with them? Do you feel that they are considering your values and your lifestyle and integrating that into their approach? All of those are going to be really important things to consider in terms of finding if a provider really matches with you.
Mm-hmm. And I would say, so we're both moms. I would say that in the pediatric realm specifically, like having that intuition and the mom gut, like that can be really indicative too. So if a provider is chatting with your child and really engaged, then that might be something positive. And if a provider is just talking to you and asking questions and only wants to hear from you, that might give you an indication that they're less interactive with kids, which is okay, not necessarily a bad thing, but maybe it's not what you value or what you want for your child if you're pursuing services specifically for your kid. What is the difference between occupational therapy and physical therapy?
So, the difference between PT and OT, they're both rehabilitation professions aimed at increasing an individual's quality of life, and that can look different based on the setting that you're in. For pediatric pelvic health specifically, at the end of the day, it really kind of matters most about the provider behind the letters and not necessarily the letters behind their name.
Yeah, I agree with that. So, both OTs and PTs go through graduate study programs, and both are entry level providers. And then it kind of depends on the provider themselves how deep they want to go into a specific area of continuing education. So, we're required to do continuing education to renew our license every few years, and the opportunities of what to dive into are numerous. But in pediatric pelvic health, there are some really great continuing education courses so that we can really become experts and specialists in this area. And so that's where, if you're seeing a pediatric pelvic health provider, they've gone through some of those courses.
And I will say that with PT and OT, in terms of our graduate programs and our foundational education, physical therapists, correct me if I'm wrong, take a more biomechanical approach, and OTs take a more biopsychosocial approach to rehabilitation. But when you get out in the workforce and you take those continuing education courses, there can be a lot of overlap as well. So, if an OT is looking to increase their biomechanical skills, they can take some biomechanical courses. And if a PT wants to build up their sensory processing skills, they can take a sensory processing course. So, lots of options out there with looking for more education and information in the areas that you want to improve on.
Yeah. And just to define those a little bit, so biomechanical kind of means the movement of the body and the alignment of the body. And so, in general, if we were to say which provider does that, a physical therapist does that. And the biopsychosocial component is like the sensory regulation, emotional regulation component that and control over our body.
Mm-hmm.
Would you say it any differently?
I would say, like, yeah, the different biological piece, psychological piece, social piece, and how they all impact somebody's function.
So don't be scared. If you're referred for services, OT or PT, pelvic health services for kids in general, let us help you get started. Have a conversation with us. We have discovery calls to help you make that decision if you want that decision, or if you want to follow the referral from your provider, that's great too. And we can make adjustments down the road as need be. We will provide that written screen questionnaire for you to kind of discern yourself to make you feel more confident in the choice of OT versus PT. And just know that we work together as a team. There is always conversation between all of the therapists happening about the patients that we're seeing. Hey, I'm stuck with this. I need some help. Or this is going really well. I think I would suggest you doing this too. Really good conversation between us and the collaboration that happens in Unconstipated Kids. So hopefully this provides some clarity. You have some tools to get started. Just know that really it's just the therapist that matters, not the letters behind their name. And just ask questions. Feel free to be empowered and be an advocate over you and your child's care, and find peace and feel good about the decisions that you're making about the services for your child. Thanks so much for being with us today. I hope that today's video was helpful. As always, we have services and resources for you, so reach out to us. We would love to help you start to find resolution for your child from their toileting challenges.